Hi, welcome to the Neuroblastoma Parent Global Symposium 2022. My name is Emma. I'm a long-term follow-up clinical nurse specialist from the UK, and I'll be facilitating this session entitled Post-Treatment, A Parent's Perspective. The session will begin with pre-recorded presentation from neuroblastoma parent and Solving Kids Cancer Family Support Coordinator Hayley Blackwell, entitled My Child Has Finished Treatment. It's okay not to feel okay. I will then be joined by our neuroblastoma parent panel, Jude, Anita and Antonia, who will introduce themselves and answer your questions and share their experiences following on from Hayley's presentation. Hayley had planned to be with us tonight, and she's been instrumental in shaping this session, but sadly, due to a family bereavement, she hasn't been able to. It's important to say that this session has been inspired and shaped by parents, for parents, to hear parents' voices, for parents to know that they're not alone in the challenges their children and family face, as well as to give an opportunity to share experiences, learning, tips and advice to help and support each other. I also want to note that as post-treatment is an area of growing understanding and need in our community, the charity organisers are actively watching the comments and chat. With that, I'd like to draw your attention to the chat function on the right side of the screen, where you can submit your questions. There's an option to do so anonymously if you choose. So now over to Hayley.
Hi everyone, it's a pleasure to be speaking to you all today about my experience with life post-treatment. My name is Hayley and I'm the Family Support Coordinator at Solving Kids Cancer UK. I'm a mum to 2 children and my daughter Eva was diagnosed with stage 4 high-risk neuroblastoma back in 2014, a week before her 2nd birthday. Although I do work in family support at Solving Kids Cancer, what I'm going to speak about is my own story and all views on my own. I do, however, have the privilege of a network of families post-treatment I've spoken to about their own experiences, and I'm going to draw on some of those today. This session is intended to be a safe place for parents to talk about how they feel post-treatment, and if I can give permission to one parent today, that it's okay if you don't feel okay post-treatment, then it'll be worthwhile. One more important thing to note is that I and those that I've spoken to live in the UK, and I appreciate the protocols are going to be slightly different across the world. But I think much of what I'll speak about will resonate widely, and I hope to leave you all with a sense of unity. You're not alone in the feelings that you might have and any challenges that you might face. So top right is a beautiful little girl called Isla, and her mum Anna now works as the donor manager for SKC UK, and she kindly gave me permission to share her photos today. And bottom right is Eva, my daughter, and these are both of the girls with the end of treatment bells. So in our case, after 16 months of frontline treatment on the NHS, we finished antibody and Eva was declared no evidence of disease, which was the best news I could hear. It was the best day. She rang that bell loud and proud, and the doctors and nurses lined the corridor and gave her the send-off that she deserved. And there was an expectation from me, certainly, that that should be the end of it. But the actual reality took me by surprise, and no one really prepared me that it is forever ongoing. So for our children, for our families, their story isn't over just yet. So I think the first immediate shock you receive is where everybody disappears to. So for 16 months, our lives evolved around appointments, both at the hospital and our local. This is not an exhaustive list of those providing care, but a brief example. The doctors and nurses were our trusted lifelines. The nurses were our best friends and our only company at some points. The community nurses came in most days when we had a break between cycles to deliver injections or dressing changes. They even came in on Christmas Day. Play workers, hospital, teachers, social workers that you're used to seeing on a daily basis, they're gone. And the charities that support, of course, there are newly diagnosed children in need of immediate support. So life goes back to normal, but no one really tells you how to do that. The support network that you had 24/7 and that safety blanket is ripped almost from underneath you. So I did reach out to a few parents, as I mentioned, and I've just got a few quotes from others. So there was a question over clarity. Who do we turn to if we have a worry? Do we go to our consultant? Do we go to our doctor? Do we go to the emergency room? They felt like they were left to fend for themselves, and it was a strange and scary feeling when they relied on hospital staff so heavily throughout treatment. And they felt that for them and for many, once they finish treatment, their support drops off a cliff. So once you have time to process emotions, because going through treatment, you don't have time to think about what's going on. You go into survival mode, you run on adrenaline, you go from appointment to appointment, your focus is on getting your child better. So at the end of treatment, you have time to process. So you feel positive, you feel happy, you feel ecstatic that your child's in remission. But along with that, as I mentioned, there's the feeling of being forgotten, and that can feel quite lonely, quite an isolating time. Eva went to play school, and to be honest, she didn't look back. The separation anxiety was all mine, but for many kids, they have trouble because they spend so much time, one-on-one, intense time with their parent. Suddenly be thrown into a new world is a lot for them. It took me far longer to get back to normal than Eva. To her, it was quite exciting to go be a kid and play with her friends from being in isolation all the time. We got back to real life. So Eva was spoiled, rightly so, during treatment. She was constantly being bought presents, and the bedtime was questionable. But now she was a normal 3-year-old child with a normal routine. So treats were scaled down, the bedtime routine was put back in place. And all the while, it felt a little bit wrong to me that she'd got better and she still deserved all of those things because she'd been through so much. But of course, you're going to create a rod off your own back if you continue to spoil them excessively. And for her, from her point of view, all she'd done was got better, and now she was getting less toys. So it was a strange transition period for both of us. And there wasn't really there's not a textbook on how to do that. Relationships and marriages, you're no longer ships that pass in the night. Maybe one parent goes to the hospital, maybe one parent stays at home, perhaps with siblings. So your relationship can sometimes take a bit of a backseat and get parked. So now you're all of a sudden at home as a family. You need to rework out who you are as a couple, perhaps. I didn't trust doctors other than our treating team. Eva was misdiagnosed quite a lot before we were eventually given the neuroblastoma diagnosis. And rightly or wrongly, I felt quite angry with our doctor. So every single ache, pain, tummy ache, headache, fever, straight after treatment, I'd convinced myself that she'd relapsed. I didn't really know what it meant to have a normal childhood illness. And now it was a normal childhood illness. I wasn't sure if I trusted the GP when he told me that now. So the whole thing took a toll on me mentally quite a lot, especially during scan time. So every scan, 3 monthly scans, I would retreat for a few weeks prior. So I knew it was coming up. I'd be pacing the corridors of that hospital. I was convinced every single 3 months that I was going to get bad news. And I think that was born from trauma of the diagnosis. Survivor guilt. Survivor guilt is a real thing. And I'm thrilled that Eva's alive and well. And I feel guilty even talking about survivor guilt and talking about all of these feelings around long-term survival when I know that we are lucky to have the outcome that we did, and many don't get to be in our position. We made a good friend during treatment at our local hospital who sadly lost her life to a different cancer. And the type of cancer that she had statistically had a better prognosis than Eva. So after this little girl passed away, I was in our local, and the nurse didn't mean anything by it, but she said to me in front of Eva, if you'd have asked me who'd have been in this position 2 years ago when the girls were diagnosed, I would have said it would be the other way around. And that was quite hard to swallow. And she didn't mean anything by it. She meant well. She meant, how wonderful Eva has done. But that was my friend's little girl that had passed away. And Eva had heard the conversation, and she said, Mum, should that have been me? And it was horrible. So overall, those feelings can lead to you feeling slightly overwhelmed. And I've lost count the number of times people have said to me, why are you not happier? Why, you should be really happy that she's done so well. And of course I am, but I'm also trying to process all of that other stuff that goes with it. And that can be really overwhelming. So although I knew there was a need from my end for support during post-treatment, I reached out to a small handful of parents to make sure we were all on the same page, and I wanted to get some quotes from other parents to showcase to my team at Solving Kids Cancer the need for better support. And this is what I ended up with. So Obviously, there's lots to say on the topic, and I've deliberately made this look a little bit chaotic to hopefully emphasize my point that there is clearly a massive need for these parents. And I don't have time to run through all of them, of course, so I've just highlighted a really small selection. One about play therapy. Children need play therapy to prepare them for the wider world. You lose who you are coming out of treatment, and you need to rebuild your identity. I feel like everyone expects me to be grateful all the time. There's no pre-awareness to how the end of treatment might make you feel. Finances are incredibly affected during treatment, which puts pressure on families to go back to work before they're ready. I feel like I can't apply for holiday homes and charity days now that he's doing well, but actually we could benefit from totally being glued back together as a family. So what do we deserve now we've finished treatment? Whole family care is really important because, of course, mum, dad, siblings, we all cope differently. I don't really post on social media anymore because I feel a responsibility to families who have lost a child. But then actually thinking about it, there are barely any stories of there is life afterwards out there. So it's a bit of a vicious circle, feeling guilty to all parties. And I thought that was a really interesting quote to include because it incorporates the survivor guilt and not knowing, whether you should post. And then also wanting to give hope to newly diagnosed families. So for this parent, they were really in that dilemma, that moral dilemma of what to do. And that was a hard place for them. So after a while, the emotional feelings do get slightly easier. And I never thought I would say that maybe a year out of treatment, but they do. But then your focus turns to a new worry, which is late effects. I'm just going to talk a little bit about late effects. So these are the same two girls in the photos in the beginning. So Eva's on the left, she's now 10, and Isla is now 7. And it's hard to adapt to a new normal when you're still visiting the hospitals regularly. So although the time between appointments does get, the gap extends, it's still quite difficult. And I signed consent forms for chemotherapy, for radiotherapy, for surgery, antibody. And I read the list of side effects at the time, short and long term, knowing that by signing those forms for treatment, I was giving her the chance of life. And at the time, I would have taken any side effect to keep Eva with me. And I thought I'll deal with that when it comes. And now the time is here and the reality is not so great. So Eva now sees a psychologist because she was referred by school. She has quite bad anxiety issues. And she's developed a stim, they call it stimming tic at school. She's constantly fidgeting. Eva came to me not so long ago and she'd been doing some Googling about her symptoms, and she came to me and said, Mom, I think I've got ADHD, which isn't impossible because the chemo-induced ADHD, I believe, is a thing. She has poor emotional regulation. She's very sensitive. She gets quite depressed. She's very emotional. She's very conscious of the scar on her tummy. So in PE, getting changed in front of her friends can be an issue, and she is a lot smaller in height than her friends, so she gets a little bit embarrassed about that. Dental issues. Eva has teeth missing where they haven't grown due to chemotherapy, so she has more checkups with the dentist than is usual. Our dentist doesn't know any children as survivors of childhood cancer, so she navigates us as we go along, and we navigate it as we go along too. But when the dentist said that she had to have more regular checkups, Eva, and she really understood, she said, Mom, more problems. And she understood now that there are more problems and they're going to be ongoing problems as a result of her treatment. And now she's getting that bit older. She totally got that. Eva has pain in her ankles. They give way, they twist regularly, and she's now under a physiotherapist. So actually we have more appointments in the calendar than we've had in a long time. And that's just the start. We've been told to perhaps expect infertility, endocrine issues, hormone problems, potential lung, heart, kidney problems. Some kids have hearing issues. So this list is not exhaustive. There is a big range of problems that our children might face. And of course, some parents will want educating in advance and some will not. And there's no right or wrong way to deal with that. So again, some quotes from parents about navigating late effects. There's lots of topics here again, and I've just drawn out a few. Parents feel they have to be proactive in fighting for what they want, and that might not be consistent across all treating centres, but that was certainly the experience of one parent I spoke to. Another parent had issues with schools and educational authorities and getting that educational healthcare plan in place for their child. There is a lot of red tape trying to get a referral for any department post-treatment, and the waiting times were long. And this parent felt like their child should get priority over other children maybe wanting to get into that service because of their history. This little girl had raised catecholamine levels, and that was done in clinic after a couple of failed IV attempts. And this little girl was very stressed, and it goes to show that even once they've finished treatment, these children are still going through a lot. Our GP sent us to A&E every single time we saw him post-treatment. So every time we had to sit and wait in the emergency room for 4 hours because he didn't want the responsibility of missing something again. Our GP is almost scared of us post-treatment because they have no idea what could be related, so they refer us back to clinic. Now, huge advances have been made in treating neuroblastoma, which is, of course, amazing. But now more kids are surviving. Has there been enough time or resources to plan what to do with these kids and how to deal with the long-term effects into adulthood? The doctors are incredible. They know how to treat the children. They know, what combination of medicine works. But do we need more? Do we need more after treatment? Because the battle's far from over once treatment finishes. And I personally dread the toll that it will take on Eva year after year if more problems arise, and the toll that it takes on us as parents as well, navigating that and helping our children through it. So the big picture, and this is not an exhaustive list, but there does need to be enhanced peer-to-peer support so that no parent or child or young adult feels alone. Maybe there needs to be a better network of other charities and organisations working together, all working towards the same goal. If there's more support, maybe parents will feel more empowered to advocate for their children, learning from other people's experiences. Can we advocate? Can we advocate for better support post-treatment? Can we educate clinicians on parents' perspective? Can we talk more about life after treatment in general, raising the awareness that the journey doesn't stop there? Can we educate GPs so that clinicians are not overwhelmed with late effects questions from parents? Perhaps at conferences like this, we could focus more on survivorship sessions. Support leaflets for teachers, helping them with what to expect with a child in their class with cancer or in remission from cancer. Can there be better support for parents trying to get educational healthcare plans in place and feeling a little bit overwhelmed with that? Therapy for all family, and I've included grandparents here because I haven't spoken about grandparents, but of course they are included because they have dealt with supporting their child, so us as parents, and then also supporting their grandchildren through treatment, and that's very traumatic for them as well. And what works for one person doesn't necessarily work for another, so maybe mum might need one-to-one therapy or dad might need group therapy. There's no one size fits all. There's also life coaching, CBT, EMDR. This is not an exhaustive list, and of course play therapy for the kids. Adults and young people late effects support, so there are the long-term follow-up clinics. And is there enough support for adults and young people transitioning into adult care? Do clinicians know how to help childhood cancer survivors into adulthood? So I want to thank the organisers at MPGS for trusting me to shape this session and present today, and thank you to the parents who gave me their time and who shared their feelings with me. And of course, I want to thank Eva, who gave me permission to talk about the challenges she is facing. Solving Kids Cancer UK has launched a 5-year strategic plan, which includes developing post-treatment support. And I'm grateful to have the opportunity to help shape and inform this new area of work. The plan was for me to be there today, but unfortunately, due to a family matter I have to attend, I can't be there. So please feel free to email me with any questions, suggestions, or comments, and I'll get back to you as soon as I can. My email address is on screen. I'll leave you in the very capable hands of our wonderful facilitator, Emma, and some incredible parents, all of whom have a child post-treatment. I hope you have a wonderful evening, and thank you for your time today.
Well, thank you to Hayley for a really incredibly brave and very insightful presentation, which I'm sure resonates with many parents and including our panel members. Before we go to questions, I'd like for each of our parents to introduce themselves. So if we can start with Anita, would you?
Yes, hi. Hi, everyone. My name is Anita. I'm a neuroblastoma parent from Hungary. I live in Budapest with my husband. We have 3 daughters, and my youngest daughter was diagnosed with neuroblastoma 10 years ago. She was 2 then, and she was classified high risk as her tumor didn't react quite the way the doctors expected. So she received a lot of intensive chemotherapy, and she had surgery. She had irradiation to her spine, and she went through stem cell transplantation as well. So as you can see, we have covered the whole menu, and her treatment lasted for 1.5 years. But now I'm fortunate enough to tell you that apart from some evolving late effects, she's doing fine. And the reason I'm here is that in 2016 we have founded a parents association in Hungary, and that's how I met Emma not so long ago. And I'm more than happy that I can be here, and thanks for the invitation, Emma and Hayley. And I've listened to the presentations today, and I've learned a lot, and I will try my best to pass the information on to the other families involved in Hungary. So thanks for having me here.
Thanks, Anita. It's a pleasure to have you. And next, Jude, would you like to introduce yourself? Okay, I think there's a little bit of a delay with Jude there. She's having some internet problems. So Antonio.
Hi, thanks so much for having me here today. So I'm here because of my son, Nate. I am very lucky to be the mom of 3 boys, and my oldest son is Nathaniel. We call him Nate. Nate was diagnosed in 2009 when he was 2 years old, and we live in Canada, so he was treated on the COG protocols. He went through the months of chemotherapy, surgery, high megadose chemotherapy with stem cell transplant, radiation, and immunotherapy. For Nate, when he was almost finished treatment, only about a week away, he relapsed in the brain. And that took us on a whole other journey, a journey to Memorial Sloan Kettering Cancer Center in New York City, where he received the intrathecal omburtamab or 8H9, as well as the 3F8 immunotherapies. And you can see him standing there with Dr. Chung, who's the founder of that treatment, which remarkably has saved his life. So he is now 15 years old, and we feel immensely blessed and highly responsible to other patients and families and clinicians and everyone part of the neuroblastoma community to give back, because we have been given so much with him. So Nate is now 15. He unfortunately last year he was diagnosed with thyroid cancer as a direct result of all of the scans that he received as a child, more than likely, and the treatment he received. Luckily, that was just quite an invasive, but just surgery. So funny how you change your language as parents after you've gone through so much with your kids, and you say things like it was just a 5-hour surgery. But we feel very lucky that he has recovered very well from that and is now in grade 10 and having the best academic years ever. So Nate has lots of different long-term side effects, and it's certainly all the ones that Hayley talked about, with thyroid cancer being the major one, with migraines and short stature, bone deformities, hearing loss, liver nodules, dental anomalies, scars, and more. I think part of the challenge now for us is navigating the fact that he's 15 and he's in charge and he is his own advocate, and being careful in terms of now how much I can share of his story and how much making sure to get his permission, as always, now as he is his own best advocate and he is really the one to tell his story. So he has allowed me to be here today, which I'm very thankful for. Everything that Hayley said is true in her presentation, and I think the biggest things for me that were the most surprising were the emotions of guilt and anger. And those were two things that I haven't experienced a lot in life until post-treatment. And they were very hard to work through and took a lot of time. They weren't something that was resolved in days or months. It actually took me years to really get through. But certainly a pleasure to be a part of this discussion and happy to contribute.
Thank you, Antonia. I don't think we've got Jude back yet. So what I'll do is we'll go straight for a question. So this is about what do you as parents feel can be done to support schools with the integration or just children into school? What would you like to see from your schools, Antonia?
Yeah, so we're kind of lucky here in Canada. We have a pretty good aftercare program, and we have in Ontario, where I'm located, we have interlinked nurses who are really specialized in helping families with that transition to school, educating, whether it's with the child's class and the teacher about the different things that the child might need, to creating individualized education plans. Like, for example, with Nate, with his hearing loss, he has an FM system, which is the microphone which the teachers use, which transmits directly to his hearing aids. So training the teachers to be able to use those types of technologies, doing things like putting tennis balls on the bottoms of the chairs, which they call hush-ups, because that sound of dragging chairs along a classroom floor is really, really difficult with hearing aids for children, and causes challenges in being able to hear instruction and teachers and important messages. So we have that, whether it's the nursing support or the educational plan support, but a lot of times it is about the parents actually having to go in and advocate for their child directly, to say, you know, like I remember going into the school and asking for a letter to go out school-wide around the importance of, if someone in the school is diagnosed with chickenpox, we need to know about it immediately, or things like that, because at that point there is no, he had not been revaccinated, and no, there are these worries that you have where there's no requirement in terms of reporting back on those illnesses to the school in Canada anyways. So it's really your own, what you feel, I think, in a lot of ways, looking for those supports, but also sort of using your heart and your gut about what your child is going to need and how you can hopefully get that support in school. So you never stop being an advocate for your child.
No. And you know your child best, so great support for your school. I can hear that. Anita?
Well, we don't have any institutionalized solution in Hungary for this to go back to school. So it's more relied on the parents and the teachers, and of course the kid herself or himself. But I guess empathy and tolerance can help a lot, and we have to be aware if our child wants to talk about it at all, if she wants the others to know that she was ill, if she wants to share details about her illness, and I guess it's very difficult, and teachers also should be educated in this field, because they can be very intolerant in cases. This is my experience, because they want to help, but it's not always useful.
Sensitive. I completely, I've heard that a lot, where it really is up to that child to decide how much they want to disclose to particularly when they move school. That can be sometimes a new start, so it's a difficult balance.
For example, my daughter didn't want to share it, but they can see the scars of the operation, so she had to talk about it, but she's really embarrassed about it.
Yeah. So is there anything a parent is asking that they should perhaps think about doing proactively as a parent post-treatment to support their child? Anita, should we start the other way around?
I think promoting a healthy lifestyle can help an awful lot, and maybe being aware that what kind of therapies that the kid received can cause what in her later development, and I think we have to trust our doctors, and we have to really listen to them at the controls, and we have to attend controls regularly, but mainly an active life, healthy food, and the most simple advices can help a lot.
Antonia, do you?
Yeah, this is a tough one. I think the most important thing is to listen to your child. They become amazing self-advocates at very young ages. And when they feel something's wrong, they will tell you usually, and they're usually right. So I think that proactive listening to your child, letting them speak for themselves is a really important thing. And that's something that we learned from a therapeutic clown actually during treatment. You know, when the clown came in the room and was doing these lovely things with Nate and asking him questions, and we were answering them, and she turned to us and she said, "You need to let him speak for himself." And we were like, that was one of the best pieces of advice we received through almost all the treatment. And I was like, yes, of course, he's 2, but he can be answering his own questions. And as he got older, he got better at that. And that's such an important thing that has always resonated with us. I think maybe this isn't totally the answer you'd be expecting, but it's to learn to have fun together again as a family. Because when you go through treatment, you kind of forget, right? You forget how to be together as a family. You forget how to be together and have fun. And to be able to find those times again, and you definitely experience those feelings of guilt often when you're doing it and when you're in those moments. But sometimes there's no better treatment that you can give yourself as a family post-treatment than having some laughs together and learning how to do that again.
Wow.
I think this is also a difficult one to when you try to get back to the normal life, that you don't give the special attention to that one child, and that you focus on the siblings as well. And it was very hard for us because my daughter was used to my complete attention, and it was very hard to get used to being just one of the 3 girls.
And that's something that comes up in our survivorship clinics, actually, that siblings and how they gel back together, just as you say, Antonio. And it's really interesting. You've got to negotiate that sibling rivalry and have some fun. Yeah. Right, let's see. So this is a question. Is there a country that's ahead or getting post-treatment support right? Good practice examples. Well, do you have any good practice examples, Antonio, of follow-up post-treatment support?
Well, I think for neuroblastoma in particular, there is the Children's Oncology Group study, which is looking at the late effects of treatment for neuroblastoma, and that's really critical, right? We need to make sure that we're really studying this, we're collecting the data on this, and we're understanding what are all the post-treatment challenges that are faced by the patients and the families. And so I think with that, having that really systematic way of collecting that data is critical. like when I speak from the Canadian perspective, unfortunately, we have very different practices across the country because even though health is federally mandated, it's provincially run. So each province does things slightly differently, which is, or doesn't do that post-treatment follow-up very well. I think it would be really, really fantastic to see a broader acceptance of the post-treatment guidelines from a Canadian perspective, from all provinces, to be able to have the aftercare clinics in every hospital, because we don't have that. And I think that's probably true in Europe and other parts of the world as well. But I think we all need to do better, and it's whether it's doing better in pockets or doing better overall.
Yeah. Anita, do you?
Well, we can only do better in Hungary, but the truth is that we have quite a good follow-up care till the children reach their 18th birthday, and we are very taken care of. But the problem is when they have to transition to adulthood, because that's when they are lost to the system. And I just learned on the Punker conference from Lorna that in Slovenia they have a very good follow-up care system, and I am with them a lot. I hope someday we will have something similar like that, because they follow the survivors to 15-20 years, and they have very close connections, and they have connections with the same doctors and nurses who know them, who know what to look for, who know what to check for, and they really make a transition and follow-up care very, very easy for them.
Yeah. And I think, here's Jude back, that you're quite right, that it's different countries have different follow-ups. I think Princess Maximus is a good place to be looking, because they have a countrywide follow-up. And also we ought to tell people about the guidelines and the information that's available online from COG, that's the Children's Oncology Group from America, and most importantly, the International Late Effects of Childhood Cancer Guideline Harmonization Group, which also have them online there. Jude, hi. We've only got a couple of minutes left. Do you want to introduce yourself? Oh, we're still not getting there. Okay. So I don't know, have we got time just for one more quick question? This is about talking to your children. I think actually, Antonia, you have already covered this, about talking to your children about their medical history. Do you have anything? I know you said about talking to the child and hearing them. Have you got anything else to add on that?
Yeah, I think it's starting small, starting in their own words, how you explain to them what they've been through. And it's also, I think, picking those words carefully. You know, we didn't talk about there being something bad about what was inside of him, but that there was something sick that we needed to make better. So it was really trying to figure out the right words to use when talking to them, so that they could use those right words too, and not have them feel like it was a reflection in a negative way on themselves personally. I think it's giving the information in parts and pieces as they get older, as they're able to retain it, as they're able to understand it. I made a mistake of giving a little too much information one time, and finding me in his room crying, and needing to step things back a little bit. So it is all about doing it at a good pace, at their pace, but making sure you are giving them the words.
So when you say the words, would you use the word neuroblastoma? This is something.
Yes, now we do. Now he's very well versed and can talk to you about the chemos that he's been on and all sorts of different things. So, but that took many years, and that's something that we do in clinic too. Now even when we go into clinic, I make him sit beside the physician's chair. I don't. He always needs to be the one now answering and speaking. And as he's gotten older, that's been a really important part of how he becomes even more of his own best advocate.
Thank you, Antonia. That's a great place to stop. I would like to take you along to all my teachings. I love the idea of ensuring that your young person sits closest to the doctor. So Nate sits closest to the doctor. That's such a great tip. Thank you very much. So that is all we've got time for. Yes, I think that we're closing. Sorry, I think I've got something to say. Sorry. So thank you again to all our parent panelists, and thank you everyone for watching and for sending in your questions. We have reached the end of the session. Remember, if you have missed a session, they will all be available to watch later on demand right here on the event platform. So up next, that's immediately after this session, we've got Dr. Daniel Morgenstern, who will be summarising today's presentations and playing a video tribute to the children affected by neuroblastoma from all over the world. So, thank you.